Hi, everyone. Good afternoon. Nice to see you all. We are going to give folks 2 minutes and we will get started at 2:02. All right. Good afternoon, everyone. Thank you for joining today's multidisciplinary information session. My name is Erica McAllister, and I am the School Health Services Liaison for the Nevada Health Authority. Before we get started, I just want to note that today's session is being recorded and transcribed. The recording and materials will be shared on the School Health Access Resource Center for anyone who isn't able to stay for this full session or would like to look back at it later. Today's session is focused on navigating the School Health Access Resource Center, which is our centralized website to support schools, providers, and partners involved in school health services. The goal of today's walkthrough is pretty simple. We're going to make sure you know what's available, where to find information, and how to use this resource center in your day-to-day work. This session will be relatively informal. I'll walk through the website itself, highlight some key pages, and then we'll leave plenty of time at the end for any questions, feedback, or discussion. All right, here is what we will cover today. So we will talk about why this website exists, who it's designed for, a walkthrough of the key sections and how to use it in your day-to-day work, and then we'll open it up for questions and feedback. And this site continues to evolve and grow based on your feedback. So your input is super valuable and important to us. All right. We created the School Health Access Resource Center, which can be found at schoolhealth.nv.gov, which I also just put a link in the chat, basically to address a few common challenges that we kept hearing from school districts and school-based Medicaid providers. So first, we were hearing that there was no single reliable place for school health services guidance. Second, schools were receiving information from multiple places and sources, sometimes with conflicting information. And third, as the program continues to expand, we kept hearing that there was a need for clear, real-time communication to help drive the expansion of this program. So this website is meant to provide one central place for school health services guidance, reduce confusion around Medicaid requirements for this program, share tools, training, and updates in real time, and to support our LEAs and providers as the program grows and changes. Okay, so this website was intentionally designed for a broad audience. So this includes school district and charter school administrators, school Medicaid coordinators at those school districts and schools, school-based providers like nurses, counselors, psychologists, social workers, therapists, and many more, and also our community partners and families. So no matter your role, there should be at least one section of this website that provides information for you and the work that you do. All right, so this site is organized into a few main categories. We have program and policy information, training and technical assistance, tools and resources, family-friendly resources and explanations of those resources, and information on our current grant and overall system modernization updates. All right, so here you can see a screenshot of our homepage. This one is designed to be your starting point, and we designed it to give you quick access to what we thought would be the main resources that you would be searching for on this website. We also have a place up in that top section where you can subscribe to our email list and listserv, which is where we send out any relevant updates or announcements. And those are also posted on the website in another area that we'll get to in a minute. Next, we have our contacts page, which is just like very self-explanatory, but this is here for you. That way you know who to reach out to depending on what questions or support you may need. So we have our School Health Services program inbox where our whole team can access and address any questions that you may send our way. My information is there. We have the School Health Services statewide coordinator contact information at NDE, which is Monica Romero. And we also have UNR's MTSS statewide coordinators contact information, Miss Casey Fleetwood. Okay, the next page we have on our website is for the School Health Access or SHA Steering Committee. The purpose of this page is to provide you guys with some transparency on who's helping us drive our initiatives and the materials from our meetings to show what we've been working on. So you'll find a list of our current charter, which is going to be updated actually in the next month or so, which is exciting. And you'll be able to find open recruitment spots here as they come up. And then this group basically comes together. We have folks who are professionals in education, health, and as well as community partners to give input in truly, like the name, steering where this program goes and what our goals are. The next page on our website is the CMS grant page. And this page basically explains the current federal CMS grant that we have right now for expanding school health services in Nevada. And again, with the goal of transparency, we have our quarterly reports and our annual reports there at the bottom for curious folks to read on. The next page is probably one of our most visited pages. This is our office hours page. And basically, you'll find information on our monthly office hours, which are held the first Thursday of every month at 11 a.m. And we've got the flyer for that. We've got the link to join there, and that link is the same each month. And then we also have another section on our information sessions, which is this right here that we're on. We have the meeting series listed there with topics, and you can click the links to register for each session that you're interested in. And then at the bottom, we have any ad hoc Q&A sessions or recorded meetings for trainings where you folks can access the recordings and any materials that go along with it. Okay, next we have our family resources page. I put a small snippet of this page here for you guys to see. We have a long list of resources on here that are directed towards families and caregivers of our students. Basically, we wanted to provide a list of, educational supports, parent or caregiver resources, behavioral health services, and any relevant connections to state agencies that may help families or students. Next, we have our news page. So our news page is going to be the central hub for updates. We post a quarterly newsletter called Hall Pass to Health, and we also post our random announcements as they come up in here as well. So in the screenshot, you can see there's part of announcement number 3 there. And these are all interactive live updates with links that you can click right on. So if you're, maybe subscribed to our listserv, but you miss an email or you just can't find it, because sometimes that happens, those will all be here. Okay, so we just have a few practical tips here for using the site. Definitely bookmark the website. We hope that you will continue to use it as a resource. Use it as your first stop for any school health services questions. You can use the links to share with your staff or colleagues, like of the trainings or any resources that we share. Take advantage of our office hours and information sessions, and also check back regularly because our team is updating it probably about once a month. All right, so that brings us to the end of a quick walkthrough through the website as it is right now. Before we open it up for questions, I just want to emphasize that this site is meant to be a living resource, so your feedback really helps us improve it and make sure that we're meeting all of your needs. And so if there's anything that you wish that you would be seeing on this website, we definitely want to hear it. So I will open up the floor for questions, comments, feedback, or you can just add it to the chat. I see a question in the chat from Magdalena. Says, do schools share this information to parents? If any school district representatives want to maybe do the react thumbs up or respond, that's a great question. If not, I can always follow up with you on that one. So, okay, it looks like Nancy from Clark County has said they've not yet shared the website, but they do share the brochures. Thanks, Nancy. Well, let's see. It looks like there's about 16 of you on here. I'm curious, maybe if you could use the raise hand function. How many of you are familiar with this website or have used it? Awesome. Love to see it. I see another question in the chat from Sharon. It says, is the website meant to be shared with parents? It can be. It's open to anyone and everyone as a resource regarding the School Health Services Medicaid program. And we do hope to evolve the family resources page to include more helpful information for them. Any feedback from folks on resources that you would like to see that are not there yet? Well, that is a pretty open-ended question, so I'll let you guys think about that. But if you do think of something, we definitely want to hear it. We have our contact information here. That's our general inbox, and then my email as well. And I see some folks are typing in the chat, so I'm going to give it a minute. Sharon says she thinks it's already comprehensive. Awesome, thank you. Magdalena says Safe Voice and 988. Yes, those are resources that are on the family resources page with links. Oh. All right. Well, I see a hand. Yes, Nancy.
You know, I'm always going to get in a last minute question, Erica. So I'm wondering, you guys had put out a web announcement last year or the year before, which was very appreciated, with a reminder that, school-based services don't affect prior auth for outside services. And I'm wondering if there's a place to link that on the parent resource page, whether it's the actual web announcement or just something at the top, because I still feel like no matter how much we shout it from the rooftops, that is one of the biggest reasons that parents don't want to sign consent. So maybe just something about that could be added.
Sure. I think that's a great suggestion. And I know we've talked about with our steering committee and even internally about creating like a family flyer, like a Q&A with, what is this program? What does it mean for their Medicaid coverage? If there's any impact, those common questions that come up, and definitely like how you mentioned.
If you want to look on our Medicaid website, we have a whole Q&A section about that. So feel free to not reinvent the wheel.
That's great. Thank you. Yep. Okay. If there's any other comments, feedback, questions, now's your chance. Otherwise, I just want to thank you all who have joined and participated. A reminder that this is being recorded, and we will be posting the recording and the slide deck to our website. So you can revisit them later, send them to your staff. And our next session is scheduled to be on February 17th, and the topic will be Plan of Care Documentation with Dana Robinson from the University of Nevada, Reno. I think that's going to be a really great topic and resource for you guys. So we hope that you'll join us for that important session. And again, if you have any questions, feedback, or ideas for future session topics, don't hesitate to reach out to us at schoolhealthservices@nvha.nv.gov. And yeah, thank you.
Thank you, Erica.